Hi, I'm Dr. Michael Kuhn, and I'm here to talk with you about the new MACI arthroscopic technique and the MACI Arthro instrumentation. As you can see here, there are a variety of instruments available for your use to adapt to any cartilage defect. As we know, the cartilage defects are not one size fits all, and these devices will really allow you to approach any cartilage defect that you feel appropriate for an arthroscopic repair. Establishing your cannula and your portal site is key to this procedure, and the MACI Arthro guides will allow you to do that. As you can see here, there are several cannula sizes, from a 15 millimeter to an 18 millimeter cannula. Once the cannula is deployed, the dams can be removed from the back to allow easy access to the joint for preparation of the defect to implantation of the MACI. Once the cannula is placed, then measuring, sizing the defect, and ultimately graft preparation ensue. The sizing guide allows you a lot of versatility in determining the size of your defect. With a simple pull, the guide retracts and pushes back in. There are 2 millimeter increments to allow you to size the defect. With simple rotation, with a singular hand technique, you can rotate this in a 360-degree manner to allow you to measure in a medial lateral and superior and inferior technique. After that's done and you've determined the approximate size of your defect, then through this working cannula with the dam removed, you've now determined your appropriate arthroscopic sizer. Through this cannula, you can now take your arthroscopic sizer and cutter and go through the cannula very smoothly and very easily. Once inside the joint with the arthroscopic sizer and cutter, you have easy access to your defect. With a simple manipulation of the device through the sliding shuttle, it can be locked in a variety of positions to allow you to oppose this to the defect into the joint, and now it'll allow you to size and score the defect. Once you've sized and scored the defect, the next step is to remove the devitalized cartilage and fiber cartilage from the base of the defect. The MACI Arthro instruments allow you a lot of versatility with this as well. There's 2 ring curettes, one square, one circular, and a rake, which allow you to create perpendicular edges to your articular cartilage defect, which are imperative for the success of this procedure. All of these can be used in different fashions depending upon the location of the defect, the size of the defect, and the access that you need. These have cutting edges and are sharp instruments which allow you to very cleanly define your lesion and get it to the appropriate level. The ring curette as well has an offset angle which allows great access through the cannula to allow you to remove the articular cartilage without causing additional cartilage delamination. Now that we've cleaned the defect and we prepared our defect for implantation, now we need to dry the joint. Through a variety of techniques, the sponge can be easily inserted through the cannula to the articular surface to allow you to dry the articular surface to prepare for the implantation. Once the joint is ready for implantation, now we need to prepare the graft. The single-use cutting block allows you a firm control of the graft while you're preparing the graft. Based upon the size that you selected for your cutting and sizing guide, there is a corresponding cutting guide for that as well. This has a sharp edge which will allow you to firmly cut the graft with a simple tap of a mallet and has a depth control stop on it as well. Once the graft is on the cutting block, it can be placed, and with a simple mallet, a simple tap, and you can cut and score the graft surface. One of the most unique aspects of this procedure is the V-shuttle guide. There are 2 sizes corresponding to the appropriate size of your graft. The V-shuttle allows you to lie the membrane on top of the device in a very atraumatic method to avoid contacting the cartilage cells. Once it's inserted on top of the device, it can be deployed through the cannula while hovering over the defect, deploying the antenna, will allow you to atraumatically introduce the membrane directly to the defect size, retracting the antenna, and the membrane will rest in its native bed. As you can see, there are a variety of instrumentation available for you during this arthroscopic procedure. While you won't use all of these during any one procedure, they're available at your disposal to assist you in a successful arthroscopic implantation.
Indication: MACI, autologous cultured chondrocytes on porcine collagen membrane, is an autologous cellularized scaffold product indicated for the repair of single or multiple symptomatic, full-thickness cartilage defects of the knee, with or without bone involvement in adults. Limitations of use: effectiveness of MACI in joints other than the knee has not been established. Safety and effectiveness of MACI in patients over the age of 55 years have not been established. Important safety information: MACI is contraindicated in patients with a known history of hypersensitivity to gentamicin, other aminoglycosides, products of porcine or bovine origin, in patients with severe osteoarthritis of the knee, inflammatory arthritis, inflammatory joint disease, or uncorrected congenital blood coagulation disorders, in patients who have undergone prior knee surgery in the past 6 months, excluding surgery to procure a biopsy or a concomitant procedure to prepare the knee for a MACI implant, or in patients unable to cooperate with a physician-prescribed post-surgical rehabilitation program. Malignancy: the risk of MACI in patients with malignancy in the area of cartilage biopsy or implant is unknown. Expansion of malignant or dysplastic cells present in biopsy tissue during manufacture and subsequent implantation may be possible. Transmissible infectious diseases: because patients undergoing procedures associated with MACI are not routinely tested for transmissible infectious diseases, cartilage biopsy and MACI implant may carry risk of transmitting infectious diseases. Presurgical comorbidities: local inflammation or active infection in the bone, joint, and surrounding soft tissue, meniscal pathology, cruciate ligament instability and misalignment should be assessed and treated prior to or concurrent with MACI implantation. Product sterility: final sterility test results are not available at the time of shipping. The most frequently occurring adverse reactions reported for MACI, greater than or equal to 5%, were arthralgia, tendinitis, back pain, joint swelling, and joint effusion. Serious adverse reactions reported for MACI were arthralgia, cartilage injury, meniscus injury, treatment failure, and osteoarthritis. Use of MACI in pediatric patients younger than 18 years of age or in patients over 65 years of age has not been established. The MACI implant is not recommended during pregnancy. For implantations post-pregnancy, the safety of breastfeeding to an infant has not been determined. To report negative side effects, contact Vericel Corporation at 1-800-453-6948 or FDA at 1-800-FDA-1088, 1-800-332-1088, or www.fda.gov/medwatch. For more information or to view full prescribing information, please go to maci.com.